亲爱的贵宾，大家午安，大家好，欢迎各位来到艾丽跟乔雅登 Volux 上市研讨会，我是今天的主持人凯咪。Good afternoon, ladies and gentlemen. Welcome to Elegant Juvenile Volux, the Taiwan launch event today. My name is Cami. It's my privilege to extend our warm welcome to all of you. 那么相信大家呢，对于乔雅登的玻尿酸产品都非常的熟悉，像是我们有适用于全脸丰盈、中脸拉提的 Voluma， 还有制造局部嘭弹、改善皱纹的 Volift， 以及精细雕琢、抚平细纹的 Volbella， 还有改善肤质、强化肌肤保水度的 Volite。而今年艾丽跟乔雅登隆重的推出，要打造360度完美 V 颜的 Volux。接下来我们将用一个精彩的开场表演来展示 Volux 它的特性以及它的优势。所以现在请大家呢将您的双手借给我。Now we'd like to have an opening show to present Volux.The greatest feature by this show. So please welcome the group Next Creative.掌声让我们欢迎气势非凡、最强领导者艾丽根医学美容台湾香港总经理林尚威。Please welcome Arrogant Aesthetics Taiwan Hong Kong the General Manager Mr. Sean Lin。
这个桥段没有 rehearsal 很多次哦，就早上1次而已。谢谢大家。大家好，我是林尚威，尚林，艾丽根香港、台湾跟艾丽根医学美容台湾跟香港的总经理。欢迎各位先辈前进，以及各位尊敬的顾客来参加我们的 Volux 丰硕上市的发表会。过去3年是艾丽根整体 portfolio 爆发风起云涌的3年。我们在2019年的时候上市了 Volite， 市面上唯一在真皮层达到保水效果长达270天的长效保湿针。而在2020年，即便在疫情的蔓延之下，我们在台湾依然上市了 Bicara 贝克脂，目前 TFDA 唯一核准的双下巴的消脂针，以及在去年9月，我们也上市了我们的酷塑酷 mini， 一个非侵入式的冷冻减脂，针对下巴的减脂效果。而与此同时，我们的4大天王，刚刚你们听到主持人介绍，包含我们的 Volbella， 我们的 Volift， 我们新上市的 Volite， 以及我们最重要的基础 Voluma， 我们的4大天王，在疫情之下，我们的网络的搜寻声量增加了70%， 透过我们的年度代言人周采诗小姐，同时也搭配一系列的 AMI 的操作，以及各位所有这个亲爱的顾客，你们的努力跟支持，我们遥遥领先我们的竞争对手，而且在客户之间造成一波又一波的回响。但是艾丽根不甘心只当一个市场的领导者，我们希望的是持续能够满足病人的 unmet needs， 同时给病人最佳的体验效果。根据一份最新的 survey， 我们发现30%的病人其实并不知道老化跟下巴有直接的关系，他们也不清楚只有0% 的人，事实上不到1% 的人发现老化对你的下颚线有着明显的影响。绝大部分的人，他们 care 的是上半脸的治疗，他们忽略了一个好的下颚线跟下巴，其实对美的整体有非常大的加成效果。那过去我们的4大天王里面有没有拿来治疗下巴？有，但是碍于我们的浓度不够高的关系，总是觉得在治疗下半脸的时候有一些的不足。艾丽根听到各位的声音，所以我们正式 launch 我们的 Volux， 我们的第5位新成员加入我们的这个家族。Volux 有什么特点？它最大的特点就是它是我们这个家族里面玻尿酸浓度最高的，也因为它的玻尿酸浓度最高，又维持凝胶式玻尿酸的特性，所以它的 G prime 跟它的 cohesivity 都是我们产品线里面最高的，代表的是它可以达到长久塑形又自然的效果。但是，即便它的浓度最高，不代表它失去过去你们最喜欢 Voluma 的几个特性。它的 extrusion force 跟现行的 Voluma 几乎是一致的，代表各位在推针的时候，还有回抽的时候，那个自然的手感跟 Voluma 几乎是一样的。同时，它的长效以及跟组织的融合度，也跟我们过去的一系列的乔尔登产品是相同的。所以你在享受它的拉提效果、塑形效果的同时，你又可以保有我们现行 Voluma 产品的所有的优点，这是我们最大的突破，也是我们今天上市发表会想要带给各位的一个惊讶的一个旅程跟体验。艾丽根除了提供好的产品给各位之外，我们更希望打造一个所谓的安心医美给所有的同仁。我们很高兴的是，在去年的5月，我们完成跟艾博伟的合并，我们现在是全世界第3大的医药公司。我们的合并营收2020年高达49个 billion， 1兆5000亿台币，超越了我们的护国神山 台积电的营收。在这样的观念之下，我们不满足只是提供好的产品给我们的顾客，我们更希望强调的是爱丽跟安心医美，这就是我们今年年度的一个口号。过去我们花了很多时间传达讯息给各位在座的咨询师跟医师，但是在2021年，我们要做不一样的事情。我们要把爱丽跟安心美这样的一个口号跟概念，植入在每一位消费者跟病人的心中。碍于法规，我们不能够直接介绍我们的产品，可是我们可以做的是什么？我们可以是把爱丽跟安心美所要强调的几个概念，包含原厂正货，包含大量科学临床实证支持的产品，我们强大的 AMI 教育团队，以及为各位病人量身定做各种不同的 treatment plan， 样颜密码、V 眼密码、窈窕密码，透过这些东西给所有的病人最好的疗程体验。这是我们在今年2021年，爱丽跟安心美所要打造的一个概念。而我们的 slogan 非常简单，叫做“美丽不用冒险”。每个人都可以变得年轻、美丽、漂亮，但是只要透过爱丽跟安心美跟各位的协助，这场旅程是可以很开心，不用冒险的。我想这是我今天主要给大家表达的几个重要关于这场 opening 的一场意向。那我们很高兴，今天我有很多来宾共襄盛举，包含我们的几位理事长，朱家瑜理事长、戴浩志理事长、曾中林理事长以及彭先理事长一起跟我们共襄盛举，以及所有的医美的中心的院长以及咨询师们一起来享受我们今天的上市发表会。我非常有信心，在今天的上市发表会结束之后，不只代表的是我们的乔雅登从4大天王变成5福临门，更重要的是，在这场发表会结束之后，你们会有满满的收获，回去之后有满满的商机，更重要的是会给病人最棒的全脸的医疗体验。谢谢大家。
接下来邀请皮肤科医学会理事长朱家瑜理事长上台为我们致辞。Now please welcome the chairman of Taiwanese Dermatological Association, Mr. 朱家瑜。
各位女士、各位先生，大家好。
好，
今天非常荣幸能够代表台湾皮肤科医学会来参加 Volux 的上市研讨会。我想，多年来台湾皮肤科医学会的全体专科医师会员一直致力于提供全台民众最好的美容医学的治疗与保健跟咨询。那今天在座也有很多台湾皮肤科医学会的专家医师会员，那我们在此非常的高兴，可以看到新一代的玻尿酸 Volux 的上市。我们也充分的感受到爱丽根公司这么多年来一直结合理论与实际，结合美容与医学，结合疗效与安全，来提供我们专科医师们最好的武器，来帮助我们的消费者跟民众。那最后呢，我也要感受到，也跟大家分享说，今年呢，爱丽根公司也跟我们台湾皮肤科医学会合作，要推出安心医美的活动。那最重要是要提供我们全体的消费者一个更安全的、更安心的一个美容医学的环境。最后在此祝福大会圆满成功，各位先生、各位女士，身体健康，万事如意。谢谢大家，谢谢。
谢谢理事长，请入座。好的，那么今天我们非常的开心，有这么多的贵宾莅临现场。那么我们重头戏马上就要开始了，跟大家来讲一下，其实今天我们邀请到的，除了是各界卓越的专家之外呢，我们也还有跟国外做连线，来跟大家分享如何做这个 Volux 的施打技巧。好，那我们就马上来欢迎2位座长来到我们的台前，并且跟我们国外来进行连线。再次让我们欢迎 彭贤礼医师以及曾中仁医师来到舞台上来担任座长。Please welcome Dr. Peter Peng and Dr. Edward Zhang to be the moderators.
那这个总经理哈，还有处长，还有所有艾利根的同仁，还有各位前辈先进啊。那我今天很荣幸跟曾理事长一起哈，可以来 moderate 这一部分。我们要脱掉啊，
可以拿下来是吧？
我们这个遵循我们理事长，刚才理事长，我们皮肤科学会的朱理事长也是这个，因为我们有跟大家保持社交距离。
也要。
我们现在好像说美国在研究说社交距离，他们要改成3个 feet 哈，3英尺。对，但是我们台湾现在还是要1.5。
现在室内还是1.8是吧？
啊，1.8。好。
室外1公尺嘛。
室外1公尺是。
对，那个我不晓得彭理事长知不知道，昨天上个礼拜我也在这边哦，下个礼拜我们还是要来这边。
哦，对。
对，先帮彭理事长广告一下哈，下礼拜他的那个雷射医学会，他担任理事长哦，在这边有2天盛大的会议，顺便大家有空就来。
对，真的欢迎大家哈。对。
呀，那我们今天就是很开心哈，那个 Volux 的上市发表会，其实这算是 delay 下来的啦。那这3月很热闹哈，有新的玻尿酸，然后有这个算是那个最坚硬的，然后可以最持久的玻尿酸。那等一下我们有精彩的节目哈，欢迎大家会喜欢哈。OK。
对，他有连线上了吗
？OK 的。
连线上。好。那我们等一下我们2位会先介绍我们今天的国外讲者哈，曾理事长是不是您先
OK
来介绍瑞哈？
那我们今天有2位那个讲者哈，第一位是在土耳其哈伊斯坦布跟我们连线的 Dr. Reha，Dr. Reha 是一个非常有名的整形外科医师哈，那他是在土耳其接受医学训练之后，有到英国到美国去接受专科医师训练，然后现在是在土耳其有开他自己的诊所哈，所以他其实有3个国家的专科医师证书哈，有土耳其的、有欧盟的、有美国的哈，所以他对于这些整形外科的东西，不管是手术或微整形的话，他都是一个专家哈。那所以他今天会跟我们连线，跟我们介绍 Volux 跟他的注射的方法。
对，那我们另外一位专家哈这个是 Dr. Reha。Hello
Reha。Dr. Reha。
Hello, how are you?
Hi.
Peter, Edward, great friends. Good to see you.
Yeah.
Yeah, very nice to
First of all, I would like to thank you all for having me.
Okay. So later we will enjoy your lecture. Okay.
那我来介绍第2位 speaker 哈，我想
Thank you very much.
很多那个大家可能都听过他的演讲了哈 ，Stephen Liu。他是plastic surgeon 哈，整形外科医师，在澳洲的整形外科医师。那他最有名的呢，事实上是他的 non-invasive 的 treatment 哈，就是非侵入性的治疗哈，尤其是这些 injection， 尤其是lifting 跟 projection 啊。那另外一个他很有名的地方啊，因为我跟他有在一起在这 Elegant 的一个 board 哈，我记得很清楚，这个那时候。那个 board 里面那个 Narendra 就讲了一句说 ，You cannot satisfy Stephen， 就是说 Stephen 是 always 不容易 satisfy 的啊，他 always 是 thinking 啊，还有很 critical 哈，对很多事情他是非常严肃的看待，而且非常认真啊 ，always thinking, learning and sharing our colleagues。所以我介绍他另外一个身份呢，我也是看到他 CV 上面写的，他自认他就是一个 educator 哈，是一个教育者，好，一直在做这些医美的教育。So let's welcome Stephen Liu.
Hi.
Hello.
Hi. Hello.
Hello， 大家好，今天是很高兴，很久没有见了，很久没有到你台湾了。今天我高兴可以跟你们在晚上跟大家谈谈我对 Volux 的观点。
Yeah, thank you. Yeah, we will introduce your lecture and your talk later. Yeah.
So it's already,
No problem. I'll see
already
you soon.
night, evening in Sydney.
It is.
OK，那是不是第一
好
个
谢？
对呀，那我们现在就开始哈。我们今天会有4段演讲。那第一段演讲就是 Dr. Reha 哈，他会跟我们介绍那个 Volux 这个新的玻尿，对台湾来讲，新的玻尿酸的一些性质。So let's welcome Dr. Reha.
Reha, it's your turn.
Hi.
First of all, as I said, it's a great honor to be with you. And I have my warmest welcome from Istanbul to my colleagues in that room. Today is an exciting day. And we will be seeing the Volux and the potential of the Volux for the entire face, but mainly on the lower face. So we obviously have typical disclosures that we need to go through. But the thing I would like to take you is lower face important? When I open up a face of a lady, you can just look at the upper face and tell me something about the face. But when I open up the lower face, it looks much more beautiful. And I think the reason is the mandible itself, which acts like a picture frame, separating the lower face than the mid-face itself. Around the world, there is a great interest on the lower face. We talk about the lower face, it is the neck, jawline, and the chin. And looking at this remarkable figure, almost 50% of the globe would like to change their shape of their either chin or jawline or both. So there's a huge potential in this area, and there's a great demand coming from the society that we need to cover their expectations. So we really need to critically analyze the ideal lower face for our patients, because without a proper diagnosis, we cannot go for a proper treatment. I would like you to take the opportunity to remember the thirds and fifths of the face. Of course, in the daily practice, it is not that easy to measure all those things. But with the current technology, we have the chance that we can do this. So the first thing is the vertical proportion that I would like you to take through. And then to subnasal, subnasal to nation area. And when we look at the vertical proportion, the lower face should be at least equal or preferably longer than the mid face or upper face. We have good candidates and candidates for this approach. And then, of course, to enhance our knowledge about the face, we have the face angles that we need to look into. When it comes to the lower face, the facial angle is the most important one. And we are seeking a degree of 165 to 175 to get the proper proportion for the lower face, which also provides us the information about class 1 occlusion. So with the facial angle, we can also decide whether the lower face is insufficient or not. And again, we have the good candidates and candidates who are below 160 degrees of the facial angle. And this gives you two things: the vertical microgenia and the horizontal microgenia. And for those, we can use the face proportion for the vertical microgania and facial angle for horizontal microgania. But is that all for the lower face? So the vertical height and the horizontal length of the mandible is important, but for the lower face, we have posterior mandibular width and the anterior mandibular width as well. Let's see what are those. The posterior mandibular width should be wider in males, and it should be equal or wider to compared to bimax width for the male patient. Also, we want the bimax length longer than the posterior mandibular width. And the anterior mandibular width is also important, which aligns with the medial canthal ligament. On the males, we have a more square appearance, whereas on the females, we have a more triangle approach. Once that is being done, obviously, the overall beauty perception is increased. So we need to perform the injections, right? And in order to achieve all the things that we're looking for, we need to really describe the surface landmarks. Menton is the lowest injection point, which is the most inferior projected point of the mandible. And then the highest one is the mental crease, which is the sulcus under the lower lip. And then we have the pogonion, which is most anteriorly projected point. And in between pogonion and menton, we have the nation. Of course, in the MD codes, we have certain codes that are relevant to these anatomical landmarks as well. So either you want to use the anatomical nomenclature or the MD codes, it doesn't matter. The critical point is the injection areas. We were talking about the certain lengths, and then in order to increase the vertical length, we should address the mental crease, the C2 and JW5. And for the horizontal length, that is JW5, C2, and C4. For the posterior mandibular width, JW1, JW2. And then we have the JW4 and C5 for anterior mandibular width. And we will go into more detail in later today's talk. Once it's being done, we need the treatment planning. And of course, we have the patient assessment criteria, but it's not good enough. We need to go for the documentation and analysis. And that is why the 3D capturing systems are very handy, not only to capture and document the patient, but also to measure all these proportions and angles very easily. We have two patient groups. One is more younger and will go to towards the beautification pathway. And then once you start to showing your aging, we have the other pathway, which is age and emotion management. Regardless of the pathway, we need to use these tools for achieving the things that we are looking for at the lower face. So what we need is the product. So today, let me introduce you to Volux. With the Volux, looking at the Vicros family member, if you just look at this table, you can tell me that nothing specific about this. However, that's not the case, and let me take you through more detail. So as we all know, this is our entire family. And Volux has slightly higher hyaluronic acid concentration than the others. Secret comes from the elasticity and cohesivity. The Volux cohesivity and elasticity is highest within the entire Vicross family. Gel elasticity is the G prime, which shows us the lifting capacity. And when you look at this chart, you can agree with me that Volux is significantly more powerful in terms of lifting tissue than the closest friend, Voluma. What about the gel cohesivity? The same thing applies. Volux is at least 3 times more cohesive than Voluma. You might think that it might be difficult to inject. Although the cohesivity and elasticity is significantly higher, the extrusion force, the injection ease of Voluma and Volux is almost the same, as you can see from this table. The product can be moldable, but just like Voluma, you have to mold the product if you need within 2 days time. So we can tell you that Juvederm Volux is as moldable as Voluma. Then for us, obviously the natural look and feeling is very important. And at that point, the tissue integration features comes into the place. And Juvederm Volux has a very favorable host tissue integration, providing what we are looking for. Water absorption is an indicator of gel swelling, and it is responsible from early swelling following the injection. And again, looking at the Volux, it is comparable to Voluma. So we are not really seeing much of a different type of swelling with Volux. However, I will try to tell you something that you will face afterwards. The duration of the products are always important. And free radical degradation is the indicator for duration of effect for hyaluronic acid fillers. Initially, we can say that Volux stays as long as Voluma stays. But looking at this chart, it is very promising, and maybe next year we will tell you that Volux has a longer duration than Voluma. Give a short summary. Volux has a very high elasticity and cohesivity, which makes this product different than others. Why? Because it provides us a significantly higher lifting capacity. It has take and resistant to free radical degradation. Easy to mold immediately after, and easy to inject because of the uniform extrusion force. And the tissue integration is very good. Of course, for any product to come onto the market, there is the clinical trials. The same thing applies to Volux. With this busy chart, I just wanted to show you that there's a very tedious study has been done for Volux. And the facial angle was taken as the study measurement. On the study patients, the anterior chin portion was taken as the study area. Fogonian, menton, prejowl, and sublabial trees were formed. As you can imagine, very encountered, and no adverse events has been seen with the product that has been used. So the injection technique with Juvederm Volux is pretty much how you will be doing with Voluma. And the least amount of pressure should be applied. And whenever you are doing needle, please do aspirate. The post-treatment advices are pretty much the same, and nothing specific to Volux. However, when it comes to the communication with patients, it is critical. Once you place the product, due to its very powerful lifting activity, the patient will feel some stiffness and firmness. And they might pronounce this for difficulty in mouth opening or difficulty in speech. This just needs reassurance. That is gonna go away like in a few days' time without doing anything. No specific side effects for Volux. And in order to avoid the risks and complications, the same thing applies with any of the injectables. And after this talk, we will hear the importance of the anatomy from our dear friend Steven. Before passing to Steven, I just want to share some clinical cases. Let's see some of the clinical cases. So this is a patient just to, go for the jawline. So we will perform the JW1, which is the angle of the mandible, and then JW3, 4 and 5, and finally JW2 to end up the mandible. And then to provide an anterior projection, we will use a C4. And for the entire lower face, we will be using Volux for that purpose. Once that is being done, we will end up with overall beautification of the patient, both from oblique and profile view. And once we start seeing the patient from side to side, you will agree with me that the lower face is much more proportionate. Sometimes the patient doesn't need the full approach for the lower face, then we just go ahead for the chin. And for this particular patient, we will be doing C1, then C2, JW4 and 5, and C4. And then we will see what kind of outcome we are achieving with this patient. This is the pre-injection. And here we go, that is the post-injection. And you will agree with me that she is much more proportionate. And as time passes, she looks even better over the time with a very natural outcome. During the smile, she looks fine and pouting as well. and we can measure the outcome easily with the 3D capturing system. And the angle of the patient has been improved significantly from 158 to 163. And the vertical lengthening was gained as well. So both horizontal and vertical lengthening has been addressed. Another patient, similar type of approach, but this time we will also do some jawline as well. Once the planning is done and performed, we see that the mandible is looking better in terms of separating the neck from the midface. Again, the angle has been improved. And from one side to another, you can see that the overall perception of the patient has been increased, although the patient is quite a young patient. I would like to stop at this point and pass the microphone back to my moderators.
Okay, thank you, Reha. Yeah,
so that we can also.
Yeah, it's a wonderful talk. Thank you. 那刚才 Reha 他的 presentation 大家看了哈，他大概就简介了一下，就是我们下半脸对于整脸的美学的重要。Sorry, I will talking in Mandarin. Sorry, Reha. Yeah, because the onsite all the physician Taiwan here. 那下半脸的美学对整体美学的重要哈，那下半脸尤其是包含下巴、下颚线这方面哈，那大家主要还有介绍整个这个 MD Code 在下半脸的运用，包含下巴在东方人很多时候都是太短或是太缩，太短你要怎么样把它拉长哈，包含这个 C1 啊、C2 啊，还有这个JW5 啊这种把它拉长。好，那 horizontal 要把它拉宽一点啊，那这个就包含 JW5 啊、C2 啊，还有 C4 啊这些的哈。那我们常常有时候是又短又缩了。那另外当然还有就是 jawline 包含它的 posterior 就事实上就是 JW1 就是这 angle 的地方跟 JW2， 好 ，2 尤其对男生又特别重要。那比较 anterior part 呢，就是我们这 C2 下面的这个是。JW4 跟5，好，那这个还有介绍，当然他有介绍这个 Volux 几个特性 ，Volux 它在 elasticity 跟cohesivity 哈，那大家去看这个 rheology 的 paper 现在非常多哈，那现在大致上认为 elasticity 跟 cohesivity 这两个因素是最大程度影响到 lifting 的哈，所以它这个跟 Voluma 来比呢 ，elasticity 大概增加1倍 ，cohesivity 大概增加了快3倍啊，就变成它原来3倍，所以它的拉提效果比较起来也比 Voluma 要好，这他们都有做一些 study。那好了以后，它推出力会不会很难推？不会，他们这个也都做 study， 它也很好推。那它并不丧失 Voluma 这样子2天之内很容易 molding 的一个特色。哦，而且呢，它吸水度不会太多哦，不会打完以后，后来就吸水了，肿得很厉害。再来呢，它52个礼拜跟 tissue integration 也非常好，那可以抵抗 free radical 的侵蚀，所以它现在效果大概到18个月。不过刚才瑞哈也有讲，可能他们后面会有 study 出来，它可能的 duration 还甚至可能会比 Voluma 还要长哦。那这是大概这个Reha 讲的有一些的重点的一些分享，最后当然他分享一些好几个这个很漂亮的 case before after 哈，不晓得大家对这个 Reha 这部分有没有什么要提问的？
没关系，那个大家有问题的话，就是从 slide 上面 key in， 我们会看到。那我们现在先把这个结束。
好，那我们接下来就是介绍我们第2个 speaker 哈，Stephen Liu， 我刚刚有介绍过他哈。Stephen Liu 呢，他是非常资深的 plastic surgeon， 尤其是对 non-invasive 哈。他接下来他要讲这个 anatomy of a low face. I think the anatomy is always very important, especially for injection, for minimum invasive treatment. So Stephen, yeah, it's your turn.
Hello, hi. Can you see and hear me well?
Yes.
Okay, guys, I'm going to talk about anatomy relevant to the Volux injection. I'm going to share with you my content now. Okay, so anatomy, as Peter Pang was saying, it is crucial to what we do to make it safe and to understand where you should place this product. Let's start. When we talk about the facial shape and the facial beauty, we know that facial shape is probably the most relevant and most important factors in determining the facial beauty. And when we talk about facial shape, it is essentially the lower half of the face that overall determine the shape. So let's have a look at the lower half. What is considered a beautiful lower facial shape? Well, you need something with a good projection and definition, particularly for Asian patients, because Asian patients in general were quite flat and protruded overall. So a good projection and definition is the key to enhance the shape of the lower face. So there are a few areas you may want to consider in terms of projection and definition. First, the chin, and of course, angle of the mandible, and lastly, the jawline. So there are essentially 5 points of bony projection.
I'm listening.
The whole face.
Yeah. Hold on.
You have your zygoma. You have your pogonian.
Yeah.
You have your angle of the mandible. So let's have a look at the anatomy of the chin. So
I think I should be mute. Yeah.
this is showing
Yep.
the fillers has been injected. You will see
Go ahead.
when we place fillers, even though we're trying to go as deep, you will see most of it are actually within the muscle. I'm going to show you how I actually do chin injection later on. So let's have the image. You have your skin, and then you have a very thin layer, very thick fat, and then you have all these sort of muscular fibers from your mentalis. You can see the two mentalis muscles deep inside, and then you have your deep fat pad between the two muscles. So this is what our chin pad looks like. Then you have your bone. Now, next you're going to see what is the function of mentalis. Mentalis is supposed to support our chin pad, right? When you have your hyperactivities, these are also the muscle that cause dimpling to your chin. We see a lot in Asian patients with their protruded structure of the chin. So let's have a look. Now, we're now thinking more in terms of the number system. So still the 5 layers to every part of your face, 1 to 5. Skin is layer 1. Then you have this very, very fibrous fat pad. This is a very different fat pad compared to, let's say, your mid-face. The next layer, of course, is your mentalis muscle. Then you have your deep fat pad. I've shown you before, the mentalis is 2 muscle. In between, there's a deep fat pad and also a deep fat underneath the muscle, and then you have your bone. Okay, once again, showing in detail the 5 layers of the chin pad. So let's have a look at what is relevant to the anatomy of the chin. Here, of course, you have your mental foramen, where the mental artery, vein, and nerve comes through. And then that's your pogonian. That's your menton, as we described. Let's have a listen to this.
This is the mandible. And in the chin region, you can see there is a protuberance in this region. This is the pogonian. This determines the most anterior part of the projection of the chin. This is where the menton is. This is the lowest part of the chin. This is the pogonian on profile view. As you can see, it is the most projected part of the chin, and this is the menton. When I want to increase the projection, only this is where I place the product. When I want to increase the height or the length of the chin, I put it right here. When I want to increase the height as well as projection, I put it somewhere in between that region.
Okay, so let's have a look at the surface landmark of the major vascular bundle of the face. The medial limbus is your best friend. If you walk away today, not remember any anatomy, that is probably the most useful surface landmark. So medial limbus is a junction between your iris and your sclera, the white part. So if you draw a vertical line down, then at the supraorbital rim, you have your supraorbital neurovascular bundle. In your midface, you have your infraorbital neurovascular bundle. And in the lower face, between the upper border of the mandible and the lower border, you have your mental neurovascular bundle. So one landmark, you can actually have 3 structures that's coming through the bone. And of course, through that landmark, you have your mental neurovascular bundle, and then you have this, which is the submental artery and nerve. Okay, so that's your neurovascular bundle. You have your mental nerve, then you have your submental. Now this has 2 ways. It goes deep, the deep branch, along the periosteum, and see the anastomosis in the 2 big bundle. Then it also has a superficial branch that will actually supply the skin and the muscle. So this is a complex anatomy. You will see this is the facial artery. The submental artery is a branch of the facial artery. The facial artery moves up the neck across the mandible, front of your masseter muscle, and then you have your submental artery going deep underneath the neck muscle. And then as you can see here, these are the superficial branch crossing the superficial fat pad of the chin. Why is this important? Oh, I'm just having some technical issue here. Just give me 1 minute. I'm going to. Okay. Okay, so let's have a look at the blood supply to the lower face now. Now, we've talked about the 2 arteries, but essentially my view on blood supply to the whole face is do not trust the blood supply that you have read from the textbook, because they are everywhere, not just what we have shown you, because there are smaller branches everywhere. What I have shown you, I just named for some of those few major branches only. So this is what I think we need to do. When you and I go to practice every day and where we inject fillers every day, we want to make sure, obviously, we create the best results so our patients happy, but we also want to make sure that we do not create significant occlusion, produce ischemia. So think about that, because I think if you look at this photograph, right in this segment here, in this area, you can see it's almost impossible to avoid any of the tiny little branches. So this is a patient referred to me. When you look at this from chin injection, you know that this is from one of the branches of the submental artery, because see the ischemia extended to the neck and the submental region. And of course, it anastomoses with the mental artery, and that's why if you look at it, all the gum are also being involved. Even though the chin is a fairly safe region of injection, this is also the area we need to be really careful. Let's have a look at the angle of the mandible. This is a fairly safe area to inject. All right, now we do the angle of the mandible because we want to also improve the overall jawline. So this is a surface, this is an illustration. We have a superficial fat pad. Then when you put the needle at the angle of the mandible, essentially most of your product are actually inject into the muscle, that is the masseter muscle, because there's no free space between the muscle and the bone. So for female, it is very important if you're going to improve the jawline, do not place it laterally, to try to go as inferior as possible, because you don't really want to widen the lower face for a female. Clearly, it's different from the man. Okay? So that's an important point, of course, just to make sure that you feel that there is no parotid gland in that region. Now, injection to this part of the ramus, particularly right there, is dangerous because the facial artery is there. So even though I'm showing you there, I inject even slower in that region. And some of you may want to think of injecting it superficially, and we can talk about whether go deep or superficial when we have the discussions. So let's go through some of the aesthetic principle of the chin. Reha has covered it. This is very simple. For men, the chin, very, very square. For female, it's more triangular. Now, this is important. The ideal chin width for men, we want it to be wider, to be around the medial limbus. And female is around the medial canthus. It's narrower and more triangular in shape for female. Now, there has been a lot of rules and a lot of lines and angles on the ideal position of the chin. And bear in mind that all of these angles are based on either Anglo-Saxons or European. None of these are actually been referenced Asian. So it's something for you to think about when you actually refer that these are some of the things that's been talked about. If you're going to use something, use the one on the right-hand side, which is the surface of the neck zone coming down here, because it's fairly simple. As a rule, I don't use them because they all assume the reference point is ideal. So if you don't trust your eyes, it's someone with a big nose, and you just reference to the nose, what do you get? You're going to get a big chin. So I don't use them as a general rule. This is important. This is important because you want to establish an ideal chin length. So for me, this is one of the few things I use from the base of the nose, the subnasally, to the midline of where the lips join together, which is 1/3, 2/3 ratio. So let's have a look at how I assess this patient.
The 40s. If you look at Jeanette, she has a fairly broad mid face and a lower face, as a result giving rise to a fairly square facial appearance. The aim of treatment here is to create a slightly more tapering to the lower face by treating the chin. If we now look at the relationship between the upper lip to the chin height, you notice that her chin is slightly on the shorter side. There's also the pre-jaw hollowing in this region. So if you look at her profile shot, clearly she is slightly retruded. This is a structural deficit. And also, it would be nice to actually increase the length vertically in this direction. So here we want to have a look at an objective measurement of the upper part of the lip and to determine the so-called ideal height. And you can see she is just shy of that height a little bit. These are my marks. So I'm going to place an injection in between the pregonium and the mentum so that I can both increase the vertical length of the chin as well as a slight projection. Elongate the chin height as well as improve a much better shape here to a more taper shape. More importantly, you notice that the pre-jaw hollowing you've seen there is improved significantly. There might still be a little hollowing that I need to improve so that transition from the jaw to chin is in a relatively straight line rather than a divot on this side. All right, on the profile view, you can see there's definitely elongation and we have a much better projection. It is important to realize that in Asian, because of the relatively flat mid-face, we don't want to bring it too excessively as per the Western culture. It just becomes disproportionate. That's why most Asian were just slightly under the standard aesthetic reference that we guys get used to. Now, okay, we have a much better transition from here to here, almost a straight line.
That was me showcasing the power of using just one syringe of Volux for a patient who are fairly heavy set in that region. And of course, we can improve a little bit more. I just want to showcase what you can do with one syringe. I'm going to share more how I do it in a minute. So with aging, of course, like everywhere else, there is a loss of volume, there is a reflation. And in female, the chin becomes wider and squarer. All right, and some in this patient, they actually drop. And of course, in some patient, you will see that it also contracted upward to create that pot orange due to the mentalis hyperactivities with the dimpling. So let's have a look at why we concentrate on the chin. Have a look at Sophia Loren, which is beautiful, but if you look at the modern aesthetic, particularly from the Asian perspective, the chin is rather square and masculine and a bit short. So if we can just elongate with Photoshop, what will happen now is the whole lower face is actually looks a little more triangular, simply with one part of the face that we can alter. So just like this patient, who is an aging patient, with select injection in the chin pad and pre-jowl, we can actually feminize, we can rejuvenate, and also make the lower face a little bit narrower. Okay, so have a look at specifically to the Asian lower face and chin. We know that most Asians have a protruded chin associated with the mentalis activities. They also have a protruded face and the piriform fossa compared to the Westerners. This is a typical Asian patient as we have described. Most Asians need projection of the central third, of the middle third, of the vertical third. So this is what I have planned for her. Injection the temple, the medial face or the inner mid face, the piriform, as well as the chin. And this is the type of result that you and I produce on a daily basis. Okay, so the 3/4 shot, have a look at how protruded and short the chin is. And this is what we use with Volux in combination with Voluma for the mid face. Now, I want to show you this because this is a classic difference between the West and the East. Have a look at now this patient on the right-hand side. The chin is certainly a lot more projected. And the jawline here is a lot more sort of prominent and angular, whereas most of my Asian patients, particularly from East Asia, they like it to be a lot softer, and the chin is certainly not as sharp as the Western counterpart. Okay, so have a look at the great difference in that part as well as the chin. So a profile view showing what we can achieve with a very reasonable amount of products. And once again, showing the difference between the East and the West. So that's all I have for you now in terms of the anatomy. I'll be happy to answer some questions or pass on to the next speaker. Peter, Edward.
Okay, thank you very much, Stephen, for your wonderful talk. Stephen have talked about the basic anatomy of the lower face, and I think it's very important for the injection of the Volux. But later, okay, here's a question for you, but for Riha. Riha, are you there? Or maybe, I think a question we will answer later when Riha had completed his second talk. 刚 Stephen Liu 有帮我们介绍的哈，那 lower face 的一些 anatomy， 我想大家应该看得很清楚哦。对于一个安心医美的话，一个注射安全注射的话 ，anatomy 非常重要的。而且这个里面他还强调了说种族的差异，还有性别的差异哈。那另外就是，我想这是每个医师都会强调的哈。 就尽信书哈，可是有时候不如无书。我们都知道说有那么多条血管，可是不是每个人都照书上长的哈。所以我们是要尊敬有这样子的 anatomy， 可是我们不要全部相信哈。你打的时候还是要自己判断一下，还是不要说书上说这边没有血管，可是它就是长了一条哈，这是大家要注意的。OK， so let's have Professor Riha. Are you there? We are waiting for your second speech. Okay. And he will talk about the 7-point and the 9-point shaped treatment concepts. So, Riha? Okay.
Excellent. Hi, can you hear me?
Yes.
Excellent. So I'm going to close down my video so that the transmission is going to be better. And let's start with the 7-point and 9-point shape over the next half an hour time. We had a great talk from Steven regarding a lot of interesting tips and tactics about the anatomical position of the face, which are very critical to achieve things. Our dear friend, Mauricio De Mayo, created this MD code system and then also provide us a cocktail of MD codes for the lower face, which we can call 7-point and 9-point shape. Within that 7-point and 9-point shape issue, we use Voluma and Volux, and we have 2 genders that has been addressed. For the females, we have 2 cheek codes, 2 chin codes, and 3 jawline codes. And all of them has different issues and helping us to achieve something else on the face. So the 7-point shape for the females starts from the mid-face, and then we will address down towards the lower face. The male, of course, has a much stronger lower jaw and chin and the entire jawline. That is why he added 2 more codes for the male lower face. So the typical 7-point, which is CK1, CK4 for the mid-facial addressing, then JW1, JW4 and 5, and C1 and C2. And for the male, to make the lower jaw stronger, we added the JW2 and C5. So once you have this chart in your hand, it becomes easy to address the issues. Although every single patient needs a proper analysis and treatment programming, this gives us a good guideline to help us to remember certain critical anatomical regions. So let's go step by step. The first one is the CK1. For the CK1, my preference is Voluma, and we will try to reach just about the bony level with our needle. And we come back using 0.1, 0.1, 0.1, or in a linear fashion, we can use a cannula as well. The critical thing here is to place our boluses on the bone itself. The zygomatic arch is very thin, and if you look at the cadaver, we can see how thin is the zygomatic arch there. If you place the product within the soft tissue below the zygomatic arch, we have the transverse facial artery, and about the temporalis start. So not only we are losing the effect of elevation, but there's a potential complication risk as well. And when we look at the medial portion, we have the zygomaticofacial artery, which is the end branch of the ophthalmic artery. That's why even when we are on the bone, to aspirate and to make sure that we are not in the closer vicinity of a vascular structure might be important. Once that is being done, to give the support from the mid-face towards the lower face becomes important. And for that purpose, we'll perform the CK4 by using a cannula, and the product of choice will be Voluma. When we really come down to the lower face, the JW1 and JW2 is very important points. JW1 is the corner of the mandible, and I do agree that the position of the injection is very important in order to enhance either inferior, posterior, or anterior projection of that corner. We can come down to the bone by using a needle and give a product of Volux, and the outcome is going to be significantly more prominent than using Voluma there. And for the JW2, we will use the cannula and leave the product in a linear fashion, starting from the corner of the mandible, the posterior angle, towards the earlobe. The combination of JW1 and JW2 is very important to address the posterior angle of the mandible itself. And at the JW1 level, if we don't think that this is good enough augmentation, then we can have a dual layer application. One layer below the muscle and one layer try to place above the muscle within the soft tissue. Anatomically, at the JW1 region, we don't have much of an issue because the facial artery is quite far from us. And the JW2, you have to be careful to be within the soft tissue. We don't want to give the product inside the parotid gland, obviously. The combination of JW1 and JW2 alone will give you an elegant look. If you pick up, for example, this patient and place the product in that area, once that is being done, the posterior angle appearance has the subtle but remarkable change that we can appreciate. The anterior injection points are JW4 and JW5. Depending on which tissue that you want to address, you can either prefer needle or cannula. And the whole idea is either to enhance the anterior projection of the lower edge of the mandible, or if you need vertical elongation, to place the product at the lower inferior border of the mandible itself. For both JW4 and JW5, just like the JW1 and 2, we will prefer Volux to be used because of this high lifting capacity. And either, as I said, needle or cannula can be used depending on whether you want to place your product on the bone or you want to do a linear injection within the soft tissue. If the augmentation is not enough, then again we can have two layers, one on the bone and one above the muscle, which we have the depressor angulioris there. Looking at the anatomicals, the lower border of the mandible is there, and just behind that we have the facial artery, and above that region we have the mental artery. So to avoid the complications, the knowledge of the anatomy and the part that Stephen gave us is very important. JW5 is the menton region, relatively a smaller square area at the midline. Again, depending on your need, the address might be on the bone or on the soft tissue. Once we reach this area, of course, we need to talk about certain other areas like C1. C1 is the mental crease, and it really provides two major issues. One of them is to provide the support to the lower lip, especially when the patient started to show signs of aging. And the other one is to provide the vertical elongation, especially for younger patients. The only way that we can do is properly by using a cannula. And my personal choice for this critical anatomical code is Voluma almost all the time. The C2 and C4 are very important injection points. C4 is the highest purple dot that you're seeing on this photo. And that is the Pogonian, most anterior projected point. And the lowest one is trying to show the JW5. And in between, we have the Nation injection point, which is C2. When it comes to the C2, we can place the injection on the bone or within the soft tissue. For the C4, though, we have to be above the mentalis muscle. Therefore, we have to be within the soft tissue. When you look at all these anatomical codes, the amount that we need to use is called active number, and it is roughly 0.5 ml per code itself. Let me show you one more detail about these three different codes very close to each other. C4 is the Pogonian, the highest point. C2 is the Nation, and JW5 is the lowest one, which is the Menton injection point. So to summarize the 7-point and 9-point shape, 7-point is an approach to give the curves to the midface and then to enhance the lower facial appearance, increasing the angle, increasing the elongation and projection in the female face. Of course, taking into consideration the ethnic background, the age, and the gender of the patient. Then 9-point shape is for more males. The same philosophy applies, but now we want to further enhance the stronger appearance of the lower face for male patients. And when we are talking about male and female, we can also talk a little bit about genderless attraction, which we can play with the codes and stay in between. So for the 7 and 9-point shape, we should remember the cheek codes, chin codes, and the jawline codes. And when it comes to volumization of the areas such as midface, the product that we will be using is going to be Voluma. On the other hand, when it is the contouring or giving more structural support, which we most of the time need at the lower face, we use Volux. Let's pick up a patient. When we look at her vertically, she might be enhanced slightly. And on the, again, vertical side, when we look at the, 1 to 165, 68 proportion that Steven told us, she seems to be okay, maybe enhanced slightly. But when we look at the facial angle, which is the sign of horizontal microgenia, she's quite behind. She is 155, although we know that she should be 165. So let's make a plan. And then, once we perform the injections and time passes, the outcome is quite natural and giving us the proportions that we are missing. And interestingly, when we look at the entire face, overall proportional improvement significantly enhanced the beauty perception of the patient, which we can see from every single angle. And the asymmetries can be addressed as well at that time. Let's see the overlapping pictures, which shows us the amount of the enhancement that we achieve. And look at the lower lip. You see how much lower lip support we are also providing, which becomes very important tool, especially for the aging sign patient. The lower face has a beautiful impact on the neck perception as well. When you look at the submental angle of this patient, for example, you can see that as if the neck has been treated as well. What we gained some vertical lengthening, and we gained a significant horizontal elongation for that. What about the males? What happens to the males? I will try to show you a video, but first let's go for the females one more time. Markings are important, and depending on what you want to do or what you believe in terms of marking, I think it's always nice to mark the areas and make a plan. Of course, you don't need the stickers. This is just for demonstration purposes. But then you can start performing the injections throughout your markings and create what you're looking for. For the 7-point shape, the starting point is the CK1. And then we will perform the CK4 by using a cannula. Of course, the CK4 nut is not on the bone. It should be on the soft tissue. Sorry for the diagram which shows the bone. Once you perform one side, to perform the other side as symmetrical as possible is important to achieve a symmetry. And if there is any asymmetric appearance of the bony or soft tissue, of course, you can address accordingly. Then let's come down to the JW1. Now it is Volux time. Come down to the bone, aspirate, and give your bolus. And usually I prefer 3 boluses in that area. Then entering from the corner of the mandible and going towards the earlobe, we give the JW2 injection. Right is done, let's do the left. Once the posterior part is done, we will move towards more anteriorly, and JW4 and JW5 can be addressed. This time from a lateral approach by using a cannula. In the soft tissue, we place our Volux to give the widening of the anterior mandibular area. Right and left is done. Let's correct the mental crease. This is the C1 region. With the C1, the preferred product that I like is Voluma, because what I need is a volumization, volume support, soft tissue support in this region. Finally, the C2 injection point is done. So the overall, the facial appearance has been improved, and from a variety of perspectives, she looks fine. What about the males? Let's see a quickly male video. Looking at him, he has a more square face, and he has a little bit of a submental fat issue. On the profile view, he needs horizontal elongation. And on the, again, vertically, he needs elongation as well. But as we want a more masculinization, we will also address the anterior mandibular width to further, widen that region. Same thing applies. Let's start from the CK1. But as this patient is a young patient and the CK4 area is already full, we will pass the CK4 and we will come down to the lower jaw region. The product stays for a long period of time. So the proper hygienic precautions are very important. Then JW1 and JW2 is being performed. And we can start seeing the difference on the right and the left. Let's address the anterior portion. We will be doing the JW4 and JW5. This time I want to stay on the bone using my needle. With every single injection point, we give a small bolus just at the edge of the mandibular lower border. Let's do the C2. And then we will perform the C4 as well for anterior projection. For widening, we will further laterally give some product at the C5 region. So he's done. And when you look at him, you can immediately see the difference. What we did, CK1, JW1, JW4, JW5, JW2, C2 and C4, and C5 for him. And that is the type of outcome and masculinization that we see. Widening of the posterior mandibular width, widening of the anterior mandibular width, both vertical and horizontal elongation of the lower face. We can see that the angle was 156 and we improved the facial angle to 163, which is the sign of horizontal lengthening that we address. So to summary the 7-9 point shape, we all know that the lower face is very important and increases the facial attractiveness in both male and female patients. The chin and jawline is particularly of importance. And in some of those patients, we have significant microgania or chin retrusion. But in some others, just a little bit of an enhancement even further improves their beautification. Duodenum volux is a very structural hyaluronic acid filler, which we can use to create and restore the structure that we are missing. And it improves the chin projection and the jawline appearance for quite a long period of time. By using a combination of MD codes, we can address many of our patients. Of course, every single patient will require a personal assessment and individualization of the products. However, CK1, CK4, JW1, C1, C2, JW4, JW5, as a cocktail of codes should be remembered so that we can use this as a kind of a guideline. And whenever it is needed, we can add JW2, C4, and for the males, C5 as well. Well, Volux is very strong. And at the lower face, we can use them. Again, at this point, I will stop and pass the microphone back to our moderators.
Thank you, Riha. It's a really wonderful talk and video. Thank you. 那 Riha 他其实介绍了这个7点跟9点这个 Sigma 的就是这个 Demel 用它的 MD code 再配合这个产品尤其是这 Voluma 它的支撑性很好不是 Volux 它的支撑性很好，特别适合做这个下巴还有这个下颚线条因为我们东方人这方面其实很缺，要 reshaping 出来。其实刚才大家有没有注意重点？一个是7点，一个是9点的女生就是7点。男生是9点，因为男生要比较 square， 所以男生会再多一个 JW2 啊，在这耳前这个地方比较垂直的方向，还有一个 C5要下巴比较宽，啊，所以男生呢下巴这个下颚角也可以宽一点，看起来比较 man 一点，然后下巴也宽一点啊。那女生呢，其实它简单的讲就是分中脸啦，中脸还是用 Voluma 啊，中脸 CK1、CK4 就是用中脸的 Voluma， 然后就是下巴的地方哈，大家记得如果 Demel 啊，我们也蛮久没碰到他了哈，1年多了。那这个下巴呢，它就是会 C1、C2 嘛，啊，再来 JW4、5，这都是下巴，都是可以用 Volux。然后对女生来讲，还加上一个下颚角，就是 JW1， 男生再加上一个 JW2， 哈，那男生呢下巴再加一个 C5。那这个综合运用呢，可以制造一个很好的下颚的这个线条啊。OK， 我们把问题放在最后哈。那 OK, so let me introduce Stephen Liu again. For your experience to use Volux for clinical practice, it's your time.
All right. Okay. Thank you very much, guys. Thank you, Reha. As you can see, Reha presented to you a very structured, a very methodical way of looking at the face and treating it. I'm going to share with you how I use Volux and how I look at the patient in a slightly different way. We all know that different one of you look at the face and learn it differently. So we thought we're going to present to you two different ways of using the same product and hopefully producing equally good aesthetic result for you. So let me just get my content for you. Okay. So I'm just going to talk about injection technique now. So we have learned about rheology. We have learned about the G prime. To me, G prime is about how strong, how much projection it can give you, right? Volux is double that of Voluma. Very easy to remember, is double that of Voluma. In fact, Volux has the highest G prime, is the entire Vicross range. Cohesivity is a very difficult concept to understand. So Volux is 3 times that of Voluma. Think of the cohesivity of Volux is identical to that of an Ultra Plus. Now, cohesivity, essentially, the definition is that of withstand the compression. So you have your G prime that when you inject to provide projection, cohesivity to me is maintaining, sustain the projection because it wants to stay together. So that's how I think of cohesivity. So we know it has the highest G prime, we know it has the highest cohesivity. So with that, it is designed not to round the face, it is designed to create that much better projection and definition that we need in the lower face, right? With the same rheology, hence it is ideal for the lower face. Because if you think about the chin has a huge resistance. You have your thick fibrous tissue, you have your mentalis. Even here, you have your thick soft tissue in that region. You do need something with a high G prime to push it out to create that projection. So in order to create projection forward, upward, sideways, to me, it works best if we can bounce it off something rigid, such as the bone. So that's why if we put it in that direction, we can use the rheology and maximize its projection rather than put it in mid-air. It has nothing to bounce. It will just move this direction. So for me, I've always liked to use Volux in the deep surface to create a projection. So what is the role of fillers in the lower face? Well, we know that when you put the fillers in the chin, you can project it forward anteriorly. Different position, you can actually lengthen it, or you can widen the lower face, right? So for me, the chin injection is the simplest injection. If you think of that concept, what you want to create, Where you're going to put it, essentially the technique is exactly the same. You can project, you can heighten, you can widen, because not everyone needs those things, as Reha have shown you. So with the structural foundation, once you affect the chin, we affect the lower face. So how do I use Volux in the lower face? Let's have a look at these videos.
All right, so the pillars technique is very, very simple. For the chin in female, I tend to create 3 pillars. Eventually, the 3 will merge into one, almost like a pyramid. And whereas in men, in order to create a very sharp chisel chin shape, square, it will be 3 separate pillars. Let me demonstrate it to you what I meant. So a female chin tends to be a little bit more tapered rather than square. That's feminine, in my opinion. So the way I created is the first pillars tend to be in the middle, the midline of the chin. So we put product mainly at the pre-periosteal, and then I would withdraw to the subcutaneous and stop. That's one pillar. Then I create another pillars next to it. Same principle, always start at the pre-periosteal level, and then when I create the pillars, it will be in oblique fashion to join into the second one. And the third pillars is next to the middle. Once again, put a right periosteum. And then as you withdraw, you inject into the subcutaneous, and the 3 will join into one. Here we have 3 of them join into one. Join into one to create a pyramid, to create a taper shape. That's what I do for female chin, to project and to shape into a taper. 3 pillars converge into one. So in men, we want to create a chin that is sharply defined, square and chiseled. So once again, it's the pillar technique. We have one pillar in the middle on the bone, and then we withdraw to the subcutaneous. Then next to it, you create a completely separate pillars, same format at the bony level, and then you withdraw the needle and inject in the subcutaneous. Next one, that define the other corner of the chin, same thing at the pre-periosteal, and then you withdraw, inject superficially, stop in the subcutaneous and not in the skin. So now you have projection, you have much better definition, and you have a square chin by the 3 pillars. Very different to a female, where we want to converge the 3 into one. Whereas in the man, it's a 3 individual separate pillars projecting separately forward. Thank you.
Okay, let's now have a look at the principle of the chin injection. So this particular lady, the idea is just to increase the anterior projection only rather than elongate, because the height of the chin is adequate. So as discussed before, I want to put it basically at the pogonian. And this is what I do.
So this is the injection at the pogonian. Needle going in, touching the bone, withdraw a little bit. And I put some micro deposit in that region, and I withdraw to create kind of a pillar. And then I get the needle in again, same needle injection point, obliquely place another micro deposit, and join in obliquely. And this is my pillar technique to triangulate and increase projection.
Exactly what we have shown before, and this was done a few years ago with Juvenile volume. Okay, so this was a case, an Asian patient with a severe mentalis hyperactivities and severe protrusion of the anterior projection of the chin. The idea here is the objective is to provide projection as well as elongation of the chin, and that was done probably about 9 or 10 years ago.
In a situation where I want to increase the projection as well as lengthening, my injection point is in between the pogonian and the menton. So this is where I'm going to place it, right there in between, and exactly the same technique as before.
So that was the result with using 3 mil of Juvenile voluma. That was done about 9 years ago. At that stage, based on what we have, based on my aesthetic, I was actually fairly happy with it. But looking back 9 years ahead, this is not a great result. Why? Because it's too round, it's too high, and we're not creating that distinctive, beautiful projection, in my opinion. That is why we need a better product to be able to create that structural definition, to be able to withstand that compression of the mentalis muscle. This is just a round chin, and chin is not supposed to be like, okay, just a round blob in that region. Majority of the Asian needs lengthening and anterior projection of the chin. So let's have a look at this young lady I've shown before. Okay, and that was the result at week 6 with 0.5 mil of Volux. Not a lot of product, and look at that very distinct creation of the shape compared to the previous case. It was just rounding off that area. And that's why, to me, this is a much more superior product in this region for this part of the face. So a 3/4 view showing what we can have, right? So clearly we have used pan-facial, we've done a pan-facial rejuvenation with the temple, with the mid-face, with voluma, and 0.5 of Volux to the chin.
Hi, this is Tanya. Tanya,
This.
as you can see, has quite a weak chin with a structural retrusion of the chin complex. On close inspection, we notice that not only she has a protruded chin, but patient with a significant structural retrusion also predisposed to a little bit of laxity in the neck submental region as well as prejaw. Hence, most of the time they come in complaining of double chin. So as you can see, she has quite a retruded chin. And there are multiple ways to measure Rickard E lines and all this stuff. I don't, because this is assuming that the nose is in the right position. So my reference point is almost around the nasal spine as a rough estimate, but most of it's eyeball. Because of retrusion, there's also significant laxity in this region, and hence it's a very short submental fossa. Frontal view again, apart from protrusion, you know that this is a little bit short. Hence, the objective in this treatment is to project and elongate this patient. When assessing patient with a significant degree of occlusion, it's good to have a look at the dental occlusion or the bite occlusion. You can see she has a mild class 2 occlusion. So now the marking, we're showing where the pogonian is, the mentum, and the green dot is where I want to place the product. My injection will be in that region, halfway between the pogonian and mentum, so that not only I can project, but also elongate and tapering the shape of the chin. Fingers at the top and bottom of where I want the product to be, and I'm entering the injection point at an angle, touching the bone, and withdraw it, and start injecting, and give it another 2 seconds for the local anesthetic to work. Here I'm using the elegant range, Juvenile Volux. The technique is still the same, a gentle micro deposit just on top of the bone, And same as before, waiting for me to feel the product touching of my two isolating finger and thumb. And injection is slow. And you may or may not notice I'm moving the needle sideways microscopically, and then up and down. So now I'm starting to feel the product, at my top fingers. I'm waiting the product to touch my thumb at the bony level. Okay, I'm feeling at the thumb. I'm withdrawing it. Keep injecting. That was one pillar. I'm going to move my fingers sideways obliquely, same as before. Touching the bone, withdrawing it. Gently putting some product in that region. Feeling the product, pushing, and I'm going to start withdrawing. Next, I'm going to go to the other side. Touching the bone, withdrawing it. So I'm not injecting directly on the bone, but just off it. Withdraw, withdraw, withdraw. Finish injecting, come back up. So this is the end result with 0.9 ml of Volux. You can see a significant projection has been achieved, much better jet balance. You can see a nicer transition in the submentum to the chin. Obviously, I have not molded this. It's quite pointy, and I'll do so in a minute. After some gentle molding, a nicer shape, a nicer projection, triangulation. If we were to be ultra critical, of course, there is some deflation in this region, but majority of the patients, this will be more than enough, because after all, more product, they have to actually pay for it. So this is less than 1 ml of product.
So that was me sharing with you by limiting myself to just one syringe of product, showcasing what we can achieve based on a very detailed analysis, based on where we're going to place the product in order to create the shaping, the projection, and the lengthening. The injection technique was slow. It was a real time to showcase to you that I inject very slowly and move the needle in order to create some safety when I inject. So that was the before, that was the immediately after with 1 ml, and that was in about a month time. Okay, so a 3/4 shot, there is not much of a loss of projection, and there is minimal swelling from Volux. Volux, we can talk about it in Q&A, is very different compared to Voluma. Volux does not swell or does not create much of the water retention. Okay, so that's showing at week 4. So sometimes you have patients like this who are vertically short in the lower half of the face. And in this patient, we want to elongate.
If I want to purely lengthen the chin, I put it at the mentum. Still do the same thing. Micro-deposit and then withdraw to create a pillar. Entering through the same injection point, placing it next to it. Withdraw. Same thing to the other side of the central pillar, withdraw. Essentially, I'm creating a tripod pillars of product to lengthen the chin.
So essentially, regardless of whether it is injection at the pagonian, the menton, or in between, for the chin, for female, I use the 3 pillars technique. Okay, so here, all I want to do is elongate by creating an inferior projection. Okay, so it was done with Voluma a while ago, just to elongate that bit. So men, and Ray have showcased is beautiful. Essentially, I want to create 3 separate pillars with Volux. Rather than 3 joined into one, it's 3 vertical pillars. And in order to create a very, very sharp look,
I use 3 separate pillars to increase the width and projection to create a very square and chisel. So first injection is right at the pogonian, create a pillar. Second, next to it. And third, on the other side. So we create 3 separate pillars, create an equal projection and a very, very sharp chisel look.
Remember, we want it to be at the medial limbus in the side pillars. Okay, so those are the things you can actually create. And that was done a while ago with Voluma, with Volux, to be able to create it in a sharper look for men. So I want to go through this case that when we did it just for Allergan in Australia, when we launched it. So this 28-year-old female has a retruded chin, and she spent lots and lots of time create a makeup just to hide the chin, and she does a beautiful job. In reality, that's what she looks like without makeup. Okay, to showcase to you the power of makeup. And essentially, if you want to be so good in facial aesthetics, learn how to apply good makeup or get some makeup textbooks. It's much better than any of the aesthetic textbooks that I can recommend you. So this is what she looks like, a ball-like effect to the chin, contraction of the mentalis, and very retruded. So the objective here is to provide projection, essentially, triangulated from that square shape. Okay, and we're going to use a 3D pillar technique.
So this is Amy. Amy is a young lady who had some fillers done to the cheek before rejuvenant volume. Looking at this lady, we notice that there is a protuberance, a ball-like effect of the mentalis due to the hyperactivities of the mentalis muscle. If we look at Amy in a profile, there's a retrusion of the mandible in relationship to the nasal spine, relationship to the nose. Once again, notice that significant activities of the mentalis hyperactivities is very, very tight. So that's what we want to achieve, to create a projection in this direction. Open your mouth a little bit. In this case, I want to showcase how we sculpt the chin so that we get a much nicer projection as well as vertical elongation of the chin. Then the last 2 injection points will be at the angle of the jaw to enhance the overall lower face facial shape.
So that was before. That's what she looks like after. So we have used essentially close to around 2 syringes of Volux just for the lower face. We use very, very little Voluma just to create the apex. If you look at this face, first of all, you see that the lower face is much more tapered and triangular. And if you look at the angle, we have not widened the angle at all. Right? So this is very, very important. When we put that fillers in the angle, you got to create at the inferior border, not the side of it. So have a look at the profile view. Once again, we're showing a beautiful projection, elongation of the neck. That's what they want. And a 3/4 shot showing that slimming effect of the lower face without widening of the lower face. Okay, so that was showing the overlay, showing the increase in projection. And this was just a little bit of animation, what we have managed to achieve. In fact, you actually get a feeling that she actually had a slimmer lower face, even though paradoxically, we have actually increased the volume. Okay, so this is by using Volux to increase the definition and projection. So that was her before with makeup, and this is her now with just a very small amount of makeup, showing a nicer chin and a nicer jawline just by that 2 areas of injection. So let's move on now to someone a little bit older with the aging process of soft tissue volume loss, reflation, as well as bone stock loss, because we know that with lower face, you have that lose a lot of bone stock around the perioral, around the alveolus, around the mandible, around the angle, as well as the ramus. This was classic lady. She was in her late 40s. She has pan-facial volume loss. Have a look at the mid-face, have a look at the jowl, have a look at the pre-existing protrusion of the chin pad with reflation. Look at the loss of definition to her jawline with a bit of hollowing that you can see. So we understand that from studies that we lost a lot of bone stock. We lost that vertical height of the ramus. We lost that sort of hollowing effect in that region. And then as a result, with the soft tissue laxity, you get that jowling effect, and you also get the chin pad that's to drop off the bone. So that was my marking for the chin. I want to basically project anteriorly, just a very, very small amount of elongation. So chin projection and reflation of the volume loss will be what I'm aiming to do. I want to improve the jawline to reduce the jowling. I want to improve the cheek projection and reflation as a total face. These are my 5 steps of creating the chin and the jawline for an aging patient. So step 1 is projection, in this case, plus or minus soft tissue reflation. Clearly, she would need a soft tissue reflation in addition to the bony projection. Okay, so that's where I'm going to do it with Volux. I'm going to overlay it with Voluma in that region. Step 2 is the mandibular angle projection inferiorly, not sideways. Okay, so that's a very accurate pinpoint in the inferior border of the bone. Step 3, clearly we need a mid-mandibular ramus support in this region. This is a danger zone because the facial artery is close by. And next, we want to do a pre-jowl support because of hollowing in that region. And then the last step is for me to create a soft tissue reflation of the ramus in level 2. So all the Volux or blue dot are being placed on the pre-periosteal level, except the chin where we put a little bit in the soft tissue. And step 5 is when I use the Voluma to actually create that soft tissue reflection with the use of cannula. So this is how I do it for this patient. I'll speed it up for you. So the chin is basically the 3 pillars that I've shown you before, 3 joined into 1. Okay, pretty straightforward. Next step, we go into the angle. Feel for the inferior border, be very precise because sometimes you miss the bone. So make sure you write on the bone. Step 3, now this is when I slow down significantly because the facial artery is close by. And this is where I move the needle even more. Okay, pre-gel on the bone. Next, I use the cannula with Voluma to overlay the projection I have created on level 2. I do not like to put a lot of product on level 2, and that's why I supplement with the bone. And the next one is the chin. Because to me, the more fillers you put in the soft tissue around the ramus, that is really show sign of aging. You're going to create ultimately a lot of weight and potentially add more to the volume in that region and exacerbate the jowling in the long run. Not immediately, in the long run, because all HA, even though they absorb very little, they do absorb some fluid. So that was her in week 6. The chin, the shadows in the chin from the reflation has been almost completely corrected. The lower face shape has been retained without widening the lower face. And these are the amount of product that I have used. Okay, 0.8 of Volux, and then I overlay it with Voluma, just for the soft tissue. I have some problem sharing again. Just give me a minute, guys. I'm going to stop sharing. Okay, so the pre-jowl region and the jawline, I use 1.2 mil of Volux and 1 mil of Voluma. In the mid-face, you can see I essentially use Voluma of 2 mil. And I'm not sure why, I'm still having some technical issues. Sure. This is always going to be the issue that we have in technology. The great effort, sometimes doing all the rehearsal and all that stuff, we get it right. Okay, the oral commissure, I use 1 mil of Volift. And that's the 3/4 shot, seeing the projection, the jawline, and the improvement in the jowl, and a much better mid-face, and a profile shot. And this was another patient doing just 1 mil of Volux in the chin, the angle, and jawline. And quite a subtle but definite improvement in that region. So in summary, you now have a variety of product in your portfolio. And this is how I use it. Voluma for the mid-face, support and volume, particularly in the inner part of the cheek. Volux for projection and definition, chin and jawline, and Volift for the more dynamic area. And that's all I have for you. I'll be happy to answer any of the questions that you may have.
Okay, and thank you very much, Stephen, for your wonderful talk and the brilliant results. You introduced a new term to us, the pillar injection technique. So is that different from sometimes we use the term tower technique or pyramid technique?
I'm sure it's the same. No, I think exactly the same. It's just that, different people use a different term.
Okay, so it's the same. Okay, thank you. 刚刚 Stephen Liu 医师介绍了一些注射的方法，大家应该看到了。那男女生注射下巴的话，它其实，虽然都是用一个叫做3点的注射方法，不过男生的3点跟女生的3点不一样哈。女生的3点，它把它变成一个金字塔在正中央，然后男生的3点的话就是3本柱哈，就是3根，然后那2个点要分开一点点，那这样才能够顶出男生比较宽的下巴出来。所以我们看到它打出来的效果是非常非常的好哈。那接下来是 Q&A 时间哈，各位是有什么问题的话就 key 到那个 slide 里面 ，slide 的那个 app 里面哈。那我看到我会来请问一下。那这边先有一个题目 to Reha。Dr. Tsai asked you about do you still use vibration device to decrease pain when you inject the Volift around the lip? So do you use the vibrator when you inject?
Well, to make the injections as comfortable as possible is very important for our patients. We use some local anesthetic creams, we use ice packs, we use vibration devices. Among all, what I found most useful is the local anesthesia to keep the patient calm and to be very precise and relatively quick when you are doing things. We did a study on vibration devices for the lip injections, and that was published about 2 or 3 years ago in Aesthetic Surgery Journal. And we didn't really find a very statistically significant comfort level change when we are using the vibration device. So in today's practice, I don't personally use it anymore.
OK，蔡医师应该有听到了哈，其实要减痛的方法很多哈。我们上礼拜也看到有些医师现在那 block 或是 local anesthesia 都还在用哈，不一定。那 vibrator 其实也是看病人，然后看你用什么剂型，然后另外常常会开玩笑哈，因为以前我们做一些其他的治疗跟这个一样都会痛哈，那我们就说刚好我诊所隔壁有个太极堂的按摩哈。我们都说要请那个师傅来脚底按摩哈，他一面按脚底，我们一面做脸上哈，那他只会注意到脚痛，不会注意到脸痛，所以大家可以利用各种方法来减轻病人的痛苦。OK， another question for Dr. Stephen Liu. Do you think the injection sequence will influence the results of the injection? Like you just inject the C1 first, then the JW1. Then JW3 or 4, but Dr. Reha injects the lateral side first, then injects the C1. So do you think the injection sequence will affect the result?
Very good question. And I keep thinking about this all the time as well. Providing that you did everything at that single session, I don't think that there will be a huge difference in between the sequence. However, saying that, I think to start laterally and come towards medially is a logical way of doing things if you want to address the entire lower face. But if you're just going to focus on the anterior portion, then I think you can go ahead and start from the C1 injection point.
Okay, Dr. Stephen Liu, what's your opinion?
It's a very good. The way that I structure the 5-step is, I've always liked to create a structural support first to anything that I do, particularly when we're talking about the aging patient. I think that's what you're referring to. I think in the lower face, ignore the mid face. This is assumed that you've done all the mid face. And my thinking has always been, if you can get your anterior projection in the right position and the posterior inferior position, right position, and then get your midline structural support, the rest is just to create that. So to me, that sequence, it makes more sense rather than get this and then do this and then do this. Because if you think about it, if you manage to improve the inferior projection or in male, widen it, you're actually taking off some of those laxity in that region. And hopefully I can't prove it. Maybe it's just like in the mid phase, you start lateral. So I'm here starting posterior lateral to improve that laxity. And then hopefully do not need that much tissue. Because this part, the mobile bit, is the one that you don't want to put too much tissue, because you already have someone who would lax, they already have jowling. If you have put so much volume in that region, at the end of the day, you're going to increase weight. So that's why I create that sequence.
Okay, thank you. 所以其实看起来其实影响不是那么大了，不过就是我们把它想成这个是一条线的两端哈，你两端先撑起来，中间再弄的话会比较轻松一点。Okay, now here's another question to both doctors. Because Volux has a higher lifting capacity than Voluma, why don't we use Volux for the mid-face lifting, like the CK1, CK2, or T1 area? Dr. Stephen Liu, would you be the first to answer?
Well, this is obviously off-label in Taiwan, but in my personal office, I do use it. I mean, it's a very, very good thinking, because if you think about it, particularly for some of the Asian patients, they have quite a thick, soft tissue in that region. And this, for me, is the ideal place, because you can use selectively less product, means less volume, and create that projection. And that's what I do in my office when they have a heavy set and thick soft tissue. But if you do have a very thin tissue, Volux, I don't think is that ideal, because it's high G prime, which means there's a higher risk or creating visibility and palpability if you are not that careful.
Okay. So, Dr. Reha, what's your opinion?
I totally agree with Steven. Let's highlight one more time. Globally, in many of the countries, it is off-label to use Volux any other place other than lower face. But of course, this is a Vicros family member that's a hyaluronic acid filler. And depending on the clinical situation and patient features, it is up to the clinician's responsibility to use it at the proper position.
OK， 那个，我想我们要尊重一下我们台湾自己的法令哈，还有我们的访单。我可以请教一下艾丽跟有谁可以回答？我们这边的访单的 indication 是怎么写？然后 contraindication 是哪里？因为这个非常重要哈，不要是医生一打下去就打完才知道违法。不晓得有谁可以回答一下这个 Volux 在台湾的访单上面写的适应症跟它的 contraindication， 所以这是写在上面的。
对，因为现在台湾卫福部它在核可的时候，都主要还是看 study 的 result。那我们 study result 现在目前主要是 focus 在下巴和下颚线，所以在台湾的 indication 就在这个部分。
嗯哼 ，OK， 谢谢。然后需要强调一下吗？那 contraindication 是鼻子是？这算 contraindication 吗？鼻子的注射？
对，很多医师可能会想说他鼻子表现怎样？那在其他国家可能没有特别规定，在台湾卫福部是把鼻子列为 Volux 的 contraindication。好，那既然它都已经列在 contraindication， 那可能如果说真的各位医师想试的话，那可能以后可能会比较多的问题，所以这个部分的话就不建议各位医师去使用鼻子的部分。
OK， 我想这个非常重要哈，这个要让大家知道。Sorry, we are just talk about the indication and contraindication of the Volux in Taiwan. Okay, so here's another question to Dr. Reha. Do you occasionally or usually inject JW2 in females? You just demonstrate the female injection with the JW2. It's usual.
Very good question. Again, of course, that depends on the aesthetic perception of the culture that you're practicing. So in today's world, what I see is most of my female patients would like to get a more stronger lower jaw appearance. And again, most of them really appreciate the posterior angle, which is going to be stronger in terms of look when I use the JW1 and JW2 together. So the straightforward answer is almost always I perform JW1 and JW together hand to hand to enhance the posterior portion. Saying that, one of the things that Steven said during the anatomy part of this day is very important. On females, the position of the injection is very important. You don't want to enlarge the posterior width too much. You want maybe the posterior elongation of that corner position or the more inferior positioning of that angle, but not really the lateral projection. So that's how you need to organize things. And how you're going to adjust that? By the amount of the product that you will be using.
Okay, thank you. 对，所以其实也是看病人的需求了。那当然，说老实话，以我自己，我也很少再打到 JW2。可是，我想中东的审美跟我们还是不太一样哈，所以他们打的可能比较多一点点。OK， here's a similar question to Dr. Steven Liu. So we just talk about the mid-face injection of Volux. So how about the Volux injection to the temple? Do you think it's okay to inject to the temple area?
I think, well, to me anyway, I don't use, my injection technique in the temple is quite different. I don't go that deep. So to answer your question, I don't use Volux in that region. I use Voluma region.
But you use cannula to...
No. I still use needle, but I do it between the facet.
Oh, okay.
So it's quite difficult to explain. So for me, I'm sure you can, but the only problem I have is, don't forget that it has a very high G prime and cohesivity, and Reha briefly mentioned it. When you start using this product in the chin, the patient will experience a very different sensation.
Okay.
They will feel discomfort, they will feel stretching for a long period of time. And my concern is if you use this product deep within the temporalis,
Okay.
you're going to get a lot of headaches in that region.
Okay.
It's something very careful.
Okay. So just as you said, it will cause some discomfort. So do you have a maximum amount of injection to the chin area?
Yeah. I'll go first and Reha will help. I do not use more than 2 ml in the chin at any one time. I will try to limit that to no more than 2 ml. For me, if you use 4 ml of Volux in that region, you're going to feel stiff, you're going to feel painful, you have patient complain they can't open or shut their mouth and affecting their speech.
Okay.
I think this is something I've noticed. Yeah.
OK，我想这个非常重要哈，这个可能大家其实 Voluma 打多了，在这个地方打很多可能不在乎哈，可是现在特别强调 Volux 跟 Voluma 其实不一样哈 ，Volux 打下去，病人的不舒服的感觉会比较明显，所以大家在打的时候要小心一点哈，不要一下打很多。结果病人打回去，第二天跟你讲，那整个晚上没睡觉哈，那大概他没睡觉，你也不要睡觉哈，因为他就会来找你了。OK， 不晓得在场还有没有什么那个问题要请问
We should get Reha's opinion on how much he used at any one setting.
OK， Reha。
Okay.
OK。
Thank you. First of all, let me give you one short comment related to temple area. Well, first of all, Voluma and Volux, these are two brothers. They're closer to each other, fine. But, you know, we have to distinguish this thing. Voluma, with its cohesivity and elasticity, is providing us volumization, soft tissue support. On the other hand, Volux, with double, G prime and triple cohesivity, gives us the structural support, contouring effect. So then the question comes in, for any of the anatomical area, do I need soft tissue support, volumization? Do I need structural support and contouring? So when it comes to the temple region, remember about the temple area. The temporal fossa is a wide area, and you need a volumetric augmentation in that area. It's not like the structural, fine, contouring, sharp, edgy augmentation that you need. That's why I do believe that in the temple region, Volux doesn't have any place or indication apart from being it's totally off-label in that area. So for the lower face, then let's say you pick up a patient for chin augmentation or for jawline, can I also use my Voluma? I think still we have a place for Voluma for very thin skin, lack of volume, very skinny patients. In those patients, I think still Voluma gives us a much nicer outcome than the Volux. But if you look at most of our patients, then what we need is the structural support at the mandible and the chin area. That's why Volux is the kind of a home runner for when it comes to the lower face. Regarding the amount, the critical amounts or the active numbers per the anatomical codes or the MD codes are important. And I take them as the upper higher limit for each of the area. So if we consider, for example, the anterior chin region, I can use JW4, JW5, which is the prejowl and the menton. And I might be using up to 1 ml per side, which brings me to the 2 ml. And then if I add a C4 and C2 injection, that is going to give me to 3 ml of Volux at the max, in that area. And I totally agree with Steven. If you go beyond that 2 ml, 3 ml limit, then the patient will start complaining about that firmness and stiffness quite a lot. In some of our patients, this 2 ml or 3 ml is not good enough to provide what we are looking for as an outcome. Then those patients will require a staging process. And why do we need that? To also avoid some other issues, like extra stretching, increased vascularity, or long-term redness. So this is just like a tissue expansion, as we might talk with our, plastic surgeons colleagues. And when I try to explain to my patients, I say, you need stages. This is just like pregnancy. I cannot have you 9 months pregnant immediately. It should be on a gradual fashion.
Okay, thank you. So do you prescribe any painkiller when you inject maybe 2 or 3 or more than 2 or 3 meals of Volux to the patient? Or just let them go home?
Steven, do you want to go first?
Yeah, I'm a little bit more conservative. I use less than 2 ml, but I do warn them. Particularly, a lot of these patients had previous fillers before. But when it comes to Volux, I pay extra precaution in telling what to expect. Because as they say, if you warn them beforehand, they will understand you. If you don't warn them, they think something is wrong because they have this done. So for those patients, if I limit it under 2, I tend not to, but I do say that if you feel uncomfortable, take some simple analgesia at home.
Okay.
I totally agree. The communication is very important. We should tell the patient what they should be expecting. I tell them that as this filler is a very strong filler, which is going to give us the structural support that we need, you might feel some stretching, firmness, stiffness for a few days, which is going to go away by itself. However, I don't give any pain medication, no oral steroids, or any prophylactic antibiotic. Once you stay within the limits, the patients handle this very easily.
Okay. 我想其实这个很重要了哈。我记得一开始应该说快20年前，20几年前我开始打玻尿酸的时候，那个时候的建议是一次不要打超过1 cc 哈。我现在20几年了哈，大家1年多1 cc， 现在一次打20几 cc 很常见。不过现在知道了哈 ，Volux 是例外，你打 Voluma 以下的，你可能组织的不舒服不会那么明显。可是 Volux 它的支撑度就是特别的高。所以大家在打 Volux 的时候要稍微手下留情我们什么 product 都会有一些 learning curve 的哈，大家不要一拿到就好像见猎欣喜就打一堆哈，那个病人的直接回馈可能就让你接下来很难过了哈。OK， 那不晓得大家还有没有什么问题？这边是有提到 so what's your opinion about the difference between the Volux and the Radius, because Radius, they claim that they have a very high lifting capacity. So comparing to the Volux, what's your opinion? Dr. Riha, do you use the Radius?
I have been using Radius since 2000, so I have a very large experience with that product. The product is a very good product. And it creates some sort of a little bit of a biostimulation as well. So I personally try to use it as the hyper diluted way. When it comes to use it for the filler and for the jawline area, I have 2 issues. One of them is, unfortunately, it's not reversible. And if you have any kind of a vascular incident, then you're in trouble. You cannot reverse the problem as if you can do it in any of the hyaluronic acid fillers. I think it's a very significant drawback because in the lower jaw area, we have the inferior labial artery, we have the mentalis artery, we have the submental artery, we have the facial artery, and these are significantly large diameter arteries. Unintentionally or due to some of the anatomical variations, you can end up with a vascular incident whenever you are doing fillers. So to know that you can reverse your product and you can reverse the vascular occlusion, I think is a very major issue nowadays. The second thing is, especially for female patients who have less soft tissue and thinner skin, if you put too much of a radius in an area to give that augmentation, they will feel a more particulated feeling underneath the skin. And some of them, they don't like it and they start complaining, saying that, doctor, I have a nodule here. So again, that's another thing. Again, when they say that, they don't like that hard feeling. It is very tough to get rid of that. You can dilute the product, but you cannot totally get rid of it.
Okay. Dr. Stephen Liu, what's your opinion?
Yeah. I think what Reha says spot on. I just have something to add. Been using Radius about the same period of time. I guess apart from that is after you inject Radius, they swell up quite a lot.
Yeah.
So it's something that I don't particularly like. I just like it to look pretty when they go out rather than just swell up. The other thing is, those of you who Radius has the highest G prime is about 1,000 from memory or 1,200.
Yeah.
They're very, very impressive when you use it. However, when they come back after 2 or 3 weeks, when the compression issues start in, you lose the significance of that projection because it is not a cohesive product. So remember I said to you before, cohesivity, to me, I think of it a very simplistic term. The more cohesive the product, the more sustained the projection you're going to get. So that is one of the big differences between it.
Okay.
And with Volux, you do not lose a lot of that projection that you get in the first instance. So that's a big difference.
Okay, thank you very much.我想这边讲得很清楚了哈。第一个，其实 Radius 打进去出问题你就完蛋哈。那玻尿酸至少还有一个解药哈。第二个是，其实 longevity 来讲的话，那个 Radius 其实没那么久了。那第三个就是这个 Radius 一开始的膨胀可能比较明显，可是等到膨胀消失了，你就看不到了。那 cohesivity 其实大家都知道哈，现在蛮强调 cohesivity 的哈，因为之前好像以颗粒型为主，现在几乎每家都在做凝胶的哈，所以凝胶的 cohesivity 其实是一个很重要的 issue 哈，所以大家可以稍微研究一下。OK， 所以我想今天的 Q&A 的时间我们想进行到这边哈，那我们把节目时间奇怪，这种没有节目了，我们先请主持人哈，那等一下中场休息之后，请大家一定要记得回来哈，因为接下来是最精彩的 demonstration。
Thank you. I would like to say thank you to all the doctors.
Thank you.
Professor Reha and Dr. Stephen. Thank you. And also Dr. Peng and Dr. Zhang.
Wonderful talk. Thank you.
Thank you. Bye-bye.
Thank you very much.
Thank you.